Congenital heart defects are the most common type of birth defect in the United States, affecting approximately 40,000 births every year. We went to LA BioMed and spoke to Pediatric Cardiologist Dr. Ruey Chang, a researcher and developer of a pulse oximeter that helps detect newborn congenital heart problems.
Pulse oximetry has been a technology available for over 20 years. It's been used everywhere in healthcare settings, hospitals, outpatient clinics, operating rooms. So for example, someone in an intensive care unit that requires monitoring of the heartbeats and oxygen level, or someone who's under anesthesia in the operating room, this will be a device that you will put on the patient to continuously monitor one of the vital signs, oxygen level and heart rate, continuously for hours. Since this new mandate for newborn screening, that we only need one reading of the baby's oxygen level, maybe after 30 seconds. Once there's stable reading, then we know if the baby does or does not have a possibility for heart disease. Therefore, this particular purpose for newborn screening is quite different from the traditional technology of monitoring using pulse oximetry. The new pulse oximeter we developed is specifically for newborns screening. Because the screening is done at the baby's foot, we made a device that fits into the baby's foot very well. And the operator will just take a device and simply place the baby's foot in. The device has multiple pairs of sensors will automatically detect where the arterial pulsations are and read out the best results. And once, after 30 seconds, a stable readout is obtained, then the operator can simply take the device off and the procedure is done. Because we don't use disposable probes, which are quite costly, between $30 to $60, the disposable cover used in this device is much, much cheaper. And also because the convenience for operators, that a device that's much more portable, lower cost, and easy to perform. We believe that this device will change the way that we're doing pulse oximetry in newborns. We're working on the FDA regulatory approval process, which will probably take between 6 to 12 months. Ryan, he is 11 years old now. When he was born, he had this congenital heart disease called coarctation of aorta. With this disease, currently we can screen with a pulse oximeter, but back in the time, it wasn't a standard procedure. Therefore, he was discharged from the hospital without the diagnosis.
I brought Ryan home, and he was a very calm baby for the first few days, and then he became getting more and more agitated as the days went on. And by the 7th day, he really wasn't sleeping at all. And I took him to our pediatrician at the time, and he said that he was fine. I called a new pediatrician and asked for her to see him. And she checked him, and she immediately went to go get her partner, and they recognized what it was. And she went right out and called UCLA. They took him right in, and then they hooked him up to all the machines, and right then and there on the machines, they could tell he was in cardiac arrest. So I think if it was something that could have been handled at the hospital upon his birth, and it still, I'm sure, would be, you want a happy, healthy baby, you don't want to have anything wrong with them, but I think all the trauma would have been removed from the situation.